Christine McDaniel here with the Health and Happiness Hacks Wellness Show. Welcome back again this week. Excited to have somebody else in medicine. This has been a trend lately. We've had a lot of people in medicine come onto the show, which is exciting because we can definitely learn from everybody in the health and wellness space. I've got Dr. Joseph here, and I will let him explain exactly what he does and how he helps people here in the community.
Thanks, Christine. I appreciate being on the show, and I'm excited to be here. I'm Dr. Joseph SCARPUZZI, and I'm a naturopathic doctor. So for those of you who aren't familiar, that I'm a primary care doctor, and I can do full intakes, labs, imaging. I can refer out if I need to. But what I do is I take a holistic approach, looking at the patient's full life and trying to get down to the root cause of what their illness is, and and then I can use a whole variety of very natural modalities to be able to treat that particular situation.
How'd you get into it?
It's a long story, but essentially I grew up with my own health problems, and we went to conventional medicine, and it didn't help, unfortunately. So my parents took me to alternative doctors after some time, and then that's when I really started to make improvements. And I came across a nutritionist in LA that did a kind of nutrition that was unlike normal nutrition, and I was so fascinated by it and had such improvement by it. And I thought, how can I do this? And she had been trained by a doctor who had passed away, and I said, there's got to be a book. And sure enough, he had written a book. So I wrote it, or read it like half dozen times over, and just soaked it up like a sponge. And then I just was like, what is the best route to be able to do this kind of medicine? And then it became a searching process of, is it a nutritionist or a regular MD, chiropractic, the whole gamut. And I basically realized that naturopathic medicine was the closest thing to it. So that's kind of the route that got me here. So,
how long have you been practicing?
So I just opened my practice in Encinitas at the beginning of this year.
Yay, congrats!
Thank you.
And Encinitas is such a great community and area for that. Like, I just love, all the alternative wellness and health seems to be that mecca where all the yogis are and all that.
Exactly.
Just San Diego. San Diego's very healthy as a county, but that's definitely the area to be in.
Yeah, we're a little more concentrated there.
No, for sure, which I love. I love
Yeah.
that. What are do you guys do any of the vitamin shots, injections, IVs, any of that kind of stuff at your practice?
Yeah, I do. I don't do IVs, but I do the IM injections, so the vitamin nutrient shots. And those are really helpful. You can get a lot of the same vitamins and nutrients in that as well as you could in an IV. Definitely can't get vitamin C though from that, so that's something to consider between choosing.
When you're deciding,
Mm-hmm.
okay. But the injection's so much quicker too, right? And easier?
Yeah, it does save time. An IV, you're going to be in the office for about an hour visit, where a shot, you're in and out in less than 15 minutes.
Nice.
So, yeah.
And so what are do you have different ones for different, which different vitamin shots? Because I've gone to some of the vitamin shot bars, they call them. There's some places where that's all they do. Like at your practice, which ones are the most popular ones?
Oh, so our glutathione shot is definitely the most popular. It is called the detox shot, but it's a little bit of a misnomer. It is good for detoxing. It really targets the liver and helps the body to detox, but you don't necessarily need to be detoxing to benefit from it. A lot of people just like it for optimal health. It's one of the body's most powerful antioxidants, and then my blend is coupled with vitamin B12 and also all the other Bs, and then some magnesium. So combined together, it helps just the liver detox, the body feel good. And
then how often would somebody come in to do that shot, do you think? What's ideal?
So it ranges, and I always tell people, try the first time, see how your body responds, because some people metabolize things very quickly, and they'll need it again in a week or less. And some people, it lasts for a long time. So I get that shot and it will last me 3 weeks. And then, so I just kind of tell each person to figure that out.
You just listen to your body and, oh, nice. And then what are some common things that people are coming to see you for right now?
So what I tend to focus on a lot is anti-aging. So I get both from the cosmetic side, where I'm doing PRP facials, and then from the more medical biochemical side with a lot of hormones. So I'm seeing different men and women for various needs. And
what's PRP facials? I've never heard of that.
Oh yeah, so PRP facials are, I think, just incredible. Everyone who I've talked to that's had it has never said they didn't like it. They all just rave about it. But it's what it is that if you've heard of microneedling.
Yes.
So microneedling is technically called ECIT, which stands for epidermal collagen induction therapy, and that, commonly known as microneedling, is the act of causing little micro traumas to the skin, and it's in the epithelial top layer, and that sends out signaling proteins to the body's fibroblasts, and those come in and they lay down new collagen and matrix, so it helps to kind of tighten and firm our skin up. But what PRP is, and this is what kind of makes me unique, because a lot of places offer microneedling, but they don't offer PRP, and I combine the two therapies. So PRP stands for Platelet Rich Plasma, and what we do is we take the patient's blood and we spin it down, and then we extract the platelet rich plasma in it, and that is filled with about a dozen or so different growth factors, signaling proteins, and even a little bit of stem cells. And we apply that to the patient's face, and then we use the microneedling to drive the PRP into the skin. And then what that does is just goes and enhances the whole process of recreating that collagen matrix.
Whoa, I've totally saw a picture on Instagram about the microneedling, and there was like blood on her face, so maybe they were layering, that's had to have been, because I don't, just the microneedling alone wouldn't cause that much blood, do you think? Or does it kind of, on the face?
It has the potential to, as depending on how aggressive they
it looked bad. It looked scary, I'm gonna be honest, but I like what you're saying, how they put that back on, and then it, how much does a facial like that cost, and how long does it take?
So a treatment will last about an hour and a half. The actual process of microneedling is much shorter, but we're taking the time to allow the numbing cream to set in and this blood to be spun and everything. But but basically it runs about anywhere from around $500 to $600 per treatment in San Diego right now. The viewers will see, obviously, if they're on my website, they're going to see that the price that I offer it for is not quite that much. But I definitely have an introductory offer right now, so I mark
to
that
build
down
your
quite a
clientele.
bit.
Oh, that's great.
Yeah.
Okay, cool. No, I love that. And that gets people on your doors, and it gets the reviews and word of mouth, and especially for treatment like that. Sounds so scary. I don't know why. I mean, it sounds cool. I'm like, that's awesome. The stem cells and just kind of, I think that anti-aging is such a big topic lately. I'm surprised we haven't talked about it more on the show, but it just seems to be more mainstream if people want to reverse the aging process. Of course, everybody wants to.
Right? Who doesn't, right?
Yeah.
But the cool thing about the PRP too is that it's since it comes from your own body, it's you have very little likelihood, almost no likelihood that there would be an allergic reaction. So it's all very natural, and it's a kind of a way to cheat aging a little bit without the all the chemicals and other stuff that might come from other treatments. But
oh, nice. Okay, cool. So so you have people coming in for that, obviously, for anti-aging. Is there any like low energy, or what are other common ailments people come in for?
Yeah, so fatigue definitely is a big one, especially with all the stress and the daily routines that life puts on us every day. And a lot of times we're looking at either adrenal issues or thyroid. So those are two big ones that really affect energy levels and fatigue. And then also the hormone, like I was mentioning, the hormone part, we're looking at both the male and female hormones as well, because as we age, those change, and that can also contribute to fatigue and low energy and such. So,
And is it in different age? Like it's not like at this age and above. It's different age brackets that probably have different hormonal issues. Have you noticed, or is it a certain age?
it really can vary, because I've seen, like in women's health, there's that point after menopause that tends to really have women feeling symptoms of menopause and wanting to come in and get that treated. But and then as men age, it's all varying as well. So there's kind of those sometimes a marker like that, but then there's also genetic mutations that can cause health problems even at young ages. So it really just depends on the whole, like what's going on in their body, and yeah. So
Nice.
it ranges. Mm-hmm.
So obviously you've studied tons and you've gone to a lot of schooling to get this far. What's your favorite book, if you had to name like a book out of all of them?
Yeah, it's funny. So I don't nearly read as much as I should, but there's one book that I tend to go back to time and time again, and that is a book on finances. And it's funny because we really don't get taught much financial advice in school to set us up to have that sort of stability and groundwork for retirement or goals or different things. So I remember my dad, when I was young 20s, he showed us this book that was all about how to handle your finances more wisely, and I just really caught on it and thought, oh my gosh, this is incredible, and I'd love to be able to put some of these things into practice. So it's called Start Late, Finish Rich by David Bach.
Oh, I've heard of it.
It's he's a motivational speaker as well as a financial advisor, and so it's one of those step-by-step kind of very practical books that I would always go back to and then see how I was measuring up and doing compared to it.
Nice. No, and I've seen David Bach speak live. It was years ago, but he's really great at all the financial stuff. No, it was mind blowing. So that's and I think I own that book. I don't know if I've read it. I need to read it. That's usually a topic of mine that I'm like, oh yeah, the financial stuff is usually not the most fun, but
I know, right? It can be dry and
yeah,
not as fun.
That's cool.
But yeah, he definitely makes you feel a little more motivated.
Oh, good. And then so self-care. So you're taking care of all these people, obviously, in the community. Like, what do you do for your own personal self-care?
So I'd say that for my mind and that mental and stress and all that component is really the beach. That's the one place that really allows me to let go and really keep my mind balanced. And then as far as my body, it's exercise, and I know that's probably like so typical of a lot of people, but it's very much my exercise that keeps me balanced and keeps me on track.
Do you have any particular types of exercise that you prefer over another?
No, I honestly just try to keep kind of a routine of cardio with also weightlifting, and just kind of make it balanced and full inclusive. But it's no particular style or anything like that.
Cool.
Yeah.
And you get, 5 days a week? How often are you exercising? Every single day?
At where I should be, I'm trying to do cardio probably 4 to 5 times a week, and weights probably about 2 times a week.
Oh, nice.
So It's not too intense, but yeah, my busy schedule sometimes.
Oh my gosh, I can't even imagine. Yeah, because you're you just started a business not too long ago, and you're the actual, practitioner in the business. So it's like you're working in it and on it.
Yeah.
So is it easy to balance that, or has it been interesting to figure out?
It has been a huge learning curve. I wear many hats. I play many roles through the whole process. So yeah, it's been an experience of huge learning experience.
And then do you have any nurses assisting you in your practice? I haven't gotten to go there yet. So is there anybody helping you, or you're in an office with other people?
I am in an office with other people. There's different practitioners, and we all have different roles and such. I'm the only doctor in my practice, and we don't have any medical assistants. I'm pretty much just doing it all.
Oh, wow.
Yeah.
Whoa, so you definitely
Yeah.
stay busy. Aw. So then what would be your number one? I'm sure you have plenty of your number one health and happiness hack.
Yeah, this was not easy to think of, but it sounds very general and cliche, but it's really about balance for me, because I realized through all the experiences of everything, the schooling that I've gone through, everything I've learned, I realized just how much balance plays a part, from everything from the smallest atom to the universe, and how, in between we have our environment, our ecosystem, and our bodies, and whether it's our mental mind state of keeping balance, because there's sometimes so much negativity that can come up in the world, and so by balancing with positive thoughts versus the work life, or work fun balance, or our biochemistry, like we mentioned hormones. I mean, everything in our entire being is all held together in this homeostatic balance. And so anything from that smallest to the largest, anything that tips the scale one direction and puts us out of balance causes problems. And so for me, it's about having this sort of lens. I kind of use it as a lens that I try to see every little aspect of my life through, and kind of measure up, okay, is that aspect in balance, or this aspect in balance?
Nice. Ooh, that's a good one. I like this hack. That's so true. No, I have friends that say that. They're like, we're just this tiny little speck, like in this huge universe, like, and they compare that, especially if there's something trivial, some issue, and they're like, really, it can't be that bad. Just keep that in mind.
Yeah.
And just keeping things in balance is huge, because when somebody's out of balance, and I think being in a wellness industry, we see that in our clients sometimes, and that's why they come in, is to get back to that level of, okay, we're balanced, we need to get balanced again, we're very out of balance. Yes. So Dr. Joseph, what's the best way for our viewers and our audience to get in touch with you?
Yeah, so they can call the office at 858-304-0567, or check out my website at NatureFix Doc, which is with a D-O-C, doc, and then .com.
I love that. Well, thanks, and then we'll have all that in the show notes too, so you guys can check them out. And thanks again for coming on the show. Absolutely. We loved having you, and thank you guys for watching. We'll be back next Wednesday. Bye.
Bye.